Lowering healthcare costs in Florida means driving innovative and proactive healthcare system reforms that work to produce better outcomes. Our state's population is expected to see substantial growth by 2030, growth that will come with unique healthcare challenges. This will require us to take a hard look at current issues, from increasing the number of medical professionals to the use of telemedicine that expands access to care and improves affordability. The Florida Chamber is actively working to promote programs that seek to lower health care costs for Florida's families. One key issue that will help achieve those lofty goals is to increase the use of telemedicine. Florida hospitals are deploying a number of innovative telemedicine services and technologies, and we are excited to hear from one of the premier pediatric healthcare providers, Nemours Children's Health System. Nemours has a children's hospital in Orlando and major pediatric specialty clinics in Jacksonville and Pensacola. Today I'm speaking with Carey Officer, who serves as the Director of Service Delivery Innovation at Nemours. Carey, a lot of people have heard the term telehealth, but not everyone knows what it means. How would you define it?
So we defined it as the use of medical information exchanged from one site to another via electronic communications to improve a patient's health status. And there really are three types of telehealth. There is asynchronous, or better known as store and forward, which involves the transmittal of medical data to a physician or medical specialist for assessment. The second area is synchronous, which is defined as interactive telemedicine services that provide real-time face-to-face interaction between a patient and provider, and sometimes even a patient provider and another provider. And then the third is remote monitoring, which enables medical professionals to monitor a patient remotely using various technological devices. And it's important to note that this is not a new medical specialty. It really is a tool or a system that allows caregivers to provide care for patients the same way they do today in a brick-and-mortar setting, but utilizing technology instead.
Now, you use this at Nemours. You use telehealth to treat patients. Give us a few examples of how it works.
Sure, absolutely. But first, I'd like to kind of start by giving you a foundation on how we have prepared ourselves to move forward with telehealth. For years, we have been developing and utilizing technology to improve patient care and improve access. We are one of the first pediatric hospitals in Florida to go paperless and earn the highest possible designation from the leading trade group for electronic health records. We're also in the process of developing technological infrastructure with 7 other top children's hospitals across the United States to produce new and better research into treatments for childhood illness and disease. And these advances in the use of technology have really given us the foundation to further develop an infrastructure that supports our current and future telehealth initiatives, some of which include teleradiology, telecardiology, which gives us the opportunity for our cardiologists to provide echo and EKG assessments through the use of store and forward technology for over 10 hospitals throughout Florida, in addition to providing our partners with technical training needed to ensure the echo and EKG reads are taken correctly. Another area that we have developed this technology is our Tactical Logistics Center at Nemours Children's Hospital, where we provide remote monitoring to all of our rooms, hospital rooms throughout the facility, and it gives us the ability to notify staff of changes that occur even in being able to remote into that room via an HD camera to see the patient to better assess the situation. And then lastly, we are providing real-time interactive telemedicine services. We are currently using technology to optimize our current transport communication for better outcomes in patient care. So instead of today, our physician utilizing the phone to discuss the patient, we are now using iPads to remote into the patient ER room at another facility to give us the ability to see and talk with the patient, the family, and the nurse and the physician all at the same time. In addition, we can see vital signs, lab printouts, and physical exam findings as well.
Carey, you mentioned a few moments ago other states using telehealth. Other states seem to be using telehealth a little bit more than we are in the state of Florida. Two-part question. One, why the disparity? And secondly, what impact does that have here on the Sunshine State?
Sure. Yes, unfortunately, there are many states that are years ahead of where we are in Florida. And the reasons they are years ahead of us is due to the adoption of state-based telemedicine reimbursement and policy reform. The American Telemedicine Association has decades of evidence-based research highlighting positive clinical outcomes with the use of telemedicine. Unfortunately, the state of Florida has been a little slow to adopt the same reform. It is now time really for Floridians to come together to help to push the adoption of robust reimbursement reform. I would like to mention that, we really do appreciate the Florida Chamber's leadership on telehealth in our state to improve access, improve outcomes, and control cost. They have been an important voice and supporter in this reform. And Nemours is very eager to see telehealth legislation passed because it will improve the health of children and families. But as an added bonus, we think it will make Florida more competitive. Employers want to operate in states where employees can access good quality care. It's really simple. Telehealth provides more access. In addition, robust reimbursement reform will further allow our pediatric specialists to provide care through telemedicine. We really have the opportunity to treat children in places that would have been impossible to get to and provide specialized care. This really opens the door for children in our state to receive the care they so desperately need and deserve. In addition to reducing the cost of care, patients and families will in many cases be able to receive care in their local communities with the same quality and outcomes as a result of utilizing telehealth.
When you talk about pediatric specialists, I know a lot of families struggle just trying to track one down. So specifically, how does telehealth provide that solution?
You're correct. A lot of families in our state are struggling to find pediatric specialists, and there is data to support it. We conducted a pediatric community health needs assessment in Central Florida in 2013, which included Orange, Brevard, Seminole, and Osceola counties. It showed that among the parents of children needing to see a specialist in the past year, over 35% had a major or moderate problem getting specialty care that they needed, which is significantly higher than the national survey that was conducted of 22%. So as you think about it, our study was in a major metropolitan area, where you think access would be a little higher. So imagine doing the same survey in some of our more rural settings. So through the use of telemedicine, we really can bring the pediatric specialist to the patient, whether they at home, in another hospital, or even in their local pediatrician's office. The use of this technology will be effective in reducing the cost of care and assisting keeping patients and families within their local communities.
Carey, thanks so much for the information today. We appreciate your time.
Great. Thank you so much.